Action.
Professor ASHRAF VIRMANI, welcome to the second annual Congress of MSERM in Morocco, in the city of Fez. You are Research Innovation and Development for Alpha Sigma in Italy as well as in Holland. You're also in research, working with many research centers within Europe, the US, as well as Africa. So my first question would be, how can we improve fertility for both men and women and stop the trend of infertility worldwide?
Yes, you see, what the main problem is now is that both for men and for women, the trend is decreasing in their fertility potential. So it's almost a 1% drop per year. So if this trend will continue, you can imagine that in like 50, 60 years, there will be no babies at all. So that would be extremely sad. So we have to try to understand why this is happening, number one. And number two, we have to reverse this, not only stop it, but to reverse this trend. And this is why we are doing a lot of research, both on the men and on the women, on actual basic, what's called the mechanisms underlying fertility, because we believe that the problems are really at a very deep level, at the level of the sperm, at the level of the egg. And if we can improve the quality of the sperm, quality of the egg, we can not only reverse the trend, we can improve the chances of fertility. In fact, if I can continue, we are doing studies in Europe, as I mentioned before, where we have seen that we can improve the quality of the sperm. And this was something that people were not believing so much, but you know, when you look at the sperm, it has to travel the distance which is equivalent to a marathon. And it has to be very fit, has to be very good health, and it has a need of a lot of energy. And for this, we can provide good nutrients to the body, make sure the man is living a healthy lifestyle, eating well, have, let's say, not too much stress. And the same kind of situation applies also to the woman. You know, good exercise, good nutrient, less stress. Stress is not a good thing for all of us, indeed. So yeah, this is some ways that we are approaching this issue. Of course, also we are looking at the biochemical and the physiological parameters underlying this as well.
I guess that's what the research is about.
In fact, yes, this is my research. Not my research only, I have to say we have many collaborators worldwide, indeed. One of the things that we focus on is the organelle within the sperm and in the ovary, which is responsible for energy. This is the mitochondria. Now, mitochondria are where most of our energy is made. You know? So if we can target that, we can maybe improve the whole situation. And that's where we are focusing a lot of our energy. In fact, energy is good. So,
excellent. So you being here with us, it's an honor.
No, it's my
and,
honor.
But I'm guessing that this Congress, for you, what is the added value of this Congress?
Well, the added value is that you are meeting people who are dealing with patients every day. And these people have experience. They are seeing the patient, they are getting feedback, and they are the ones that have to drive us to say, okay, we need to somehow solve these kind of problems. Because we are mainly researchers, and then we... Yes, and we need their help.
Yes.
And we need to talk to each other. Because a lot of the times, the medical practitioner remain in his field, and the researcher remain in his field.
Yes.
And there has to be crosstalk. We need to be interdisciplinary. We need gynecologists to talk to andrologists, and vice versa. And all of us have to try to think of a solution together.
Yes.
And this is a good opportunity.
Just out of curiosity, since there are so many nationalities
Yes.
here today in Congress, did you get similar feedbacks from different experts from different countries? Are the stories similar, or are they different?
Well, there are differences, believe me. You know, in different countries, there's, let's say, different fashion as well. So a lot of people in one country will be saying, no, it's good to try exercise and, you know, yoga. And in another country, there'll be, no, we have to stick to pharmaceutical or just to evidence-based, you know. So we have to find a balance.
So that's why
you know.
the
Congress
has
is
been
good.
organized
Exactly.
exchange and
Exchange.
this kind of bond.
Absolutely.
Absolutely.
And we need people to give us their opinion, their point of view, and we have not to exclude anyone. You know, yoga could be good, evidence-based medicine can be good. Why not? You know,
Perfect, perfect. I like this message.
Thank
you
you.
so much, Professor VIRMANI, for being with us here. It's an honor. And
No,
welcome
thank you.
again to Morocco. I hope
Absolutely.
you have a great time.
Thank you so much.
Thank
My
you.
great privilege.